Hello, everyone, and welcome to Official SWAT for Nursing Assistant Skills and Education, your true way to success. In this presentation, we will be learning about patient bathing. Bear with me, stay focused, and pay close attention. It is very important, this presentation, for your written exam and your skills. The objectives are to describe the safety precaution for patient bathing, the purpose of bathing a patient, the bed bath procedures, and modified bed bath skill demonstration for your skill. Those terms are very important for you to memorize or to get familiar with. Axilla, genitalia, perineal care, pubic, and perineum. Axilla is your underarm, or known as armpit. You also can take temperature underarm. As you see, the arrow is pointed out to axilla underarm. Perineum is the tiny layer of skin between the genitals, which either vaginal opening or scrotum and anus, and you can see perineum. And see in the picture, it's very tiny, and this area is very prone to tear off during labor. Perineum. Genitalia, the organ of the reproductive system, especially external genital organs. They are the external genital organs. Either male penis or female vagina. Perineal care or pericare is a cleaning the patient or individual genitalia, which we just covered the previous slide. Because the area is prone to infection, it must be cleaned at least once a day or more frequent if the patient or the individual suffer from incontinence. What is incontinence? When a person cannot control the bowel or the bladder, so we need to be cleaned. As for all of us, bathing is very important. A daily bathing is very important whenever it's possible. Following a bath, you feel like relaxed, clean, refreshed, high self-esteem. You feel good about yourself. And it should be with warm water and mild soap. Why bathing is very important, and what is the benefit of getting a bath, a daily one? It removes, first of all, it removes the dirt or the perspiration when we sweat and start getting sticky. So once you wash with warm water and soap, you feel refreshed, and it increases circulation. So once you're rubbing with washcloth and soap, you're really increasing your circulation, your body's circulation. All right, and you provide a mild exercise. What's those mild exercise is when you're moving, like trying to rub yourself, trying to wash yourself. Those are exercise. All those movements you do while you're bathing, either for you or for your patient, those are mild exercise. Then as a nurse, as a CNA or certified nurse assistant, it gives you opportunity to close observation, very close observation. You can see the skin, you can smell, you can see if there is a swelling, you can see if there is a rash, if there is a bruising, if something like it's not normal. That is provide you with close observation that you're going to report to your RN. And of course, it boosts self-esteem, and you feel good about yourself as a patient feels good about itself. There are many ways of bathing. Tub bath. So when you have the tub, you fill it up with warm water and you help your patient to get in that bath. Or a shower bath, which is my favorite. The showers and the top of your head and you're bathing yourself. complete bed bath when a patient is not able to go to the shower room or bathroom, so you help him while he's in or her in the bed. Partial bed bath, self-sponge bath, or waterless bath. So when you give a patient or a resident a sponge with water and help himself like clean and rinse and dry. And perineal care. For the purpose of this class, of this presentation, we are going to just focus on a partial bed bath or modified bed bath. Observation is very important skill. So during bathing your patient, special attention should be given to skin area that touch each other, like between the legs, underarm, under breast, under the scrotum, groins, between the buttocks, around the anus, and under folds of the skin, especially with overweight individuals. So when the area touch each other, it creates friction, and friction can create skin tears. So we need to pay attention to those areas to find out that skin's still intact. The area that touch each other can accumulate bacteria and germs, and if we do not clean them and wash them up, it can create irritation and rash. To find out those areas where are located, refer to slide number 5. All those areas need to be washed with warm water, mild soap, then rinsed, then dry pad dry it, because you don't want to scrub while you're drying because you're going to tear the skin. Next, be mindful about cultural preferences or considerations. There are some patients, they won't receive care except from the same-sex gender. So you have to honor their request and don't be offended. In some culture, which I really am aware of, like men cannot be with a woman in the same room except if the woman is like fully covered head to toe. So we have to be careful. Even the touch, you have to be careful and be free from your own biases. You may also come up across a difficult situation, especially while you're bathing an Alzheimer's patient or demented patient. They might perceive your help to them as a sexual assault while you're trying to handle their body part. They will start yelling, shouting, they might get violent, and they might get aggressive and combative. For your safety, for that specific patient's safety, you got to stop the bathing procedure and think about another way to help them out to wash. Most importantly, check with your nurse for your safety and that specific individual safety also. You as a certified nursing assistant is frequently assigned to bath a patient. It is very important to follow the guideline and the procedure for bathing carefully to ensure your safety and patient safety and comfort. You should apply the principle of standard precaution. What are the standard precautions? Are the basic level of infection control that you should be using in all setting with all patients to reduce the risk of transmission of organism. So what you should do, you should wear your gloves, you should wash your hand, and you should wear your PPEs, which is your personal protective equipment, especially if you're bathing a patient that has a C. diff. That's just an example. All right. You should be safe, and your patient should be safe also. While you're bedding your patient, or even after finish bedding your patient, do not cross-contaminate body site by wearing the same pair of gloves. During your skill test, your evaluator will give you a form that has the skill that you need to perform. One of them is going to be modified bed bath. I'm not saying that for sure because each candidate has different 5 scales, but let's assume that you have the modified bed bath. Make sure to read your card. Keep it with you too. You are allowed to keep it with you. So modified bed bath, it will ask you to bath a patient or give a bed bath, face, one arm, hand, and underarm, axilla. So for the purpose of your skills, we are going to demonstrate modified bed bath for the next in the next coming a second part of this and the second part of this presentation. For clarification, the upcoming video took place in a client home. So the setup is different than hospital or nursing home setting. But the most important part of the scale are always get permission to enter a patient or the client home, explain the procedure, speaking clearly, slowly, and directly, maintaining face-to-face contact, provide a privacy with curtain or with doors. Remember, when you're taking a shower, of course you're going to change your clothes. You're not going to put back the same thing. So just remember to bring a gown, a new clothes with you before start showering your patient because you need to change them, or before bathing your patient because you need to change the clothes. And this is very important because that is happening. As an evaluator, I came up across the situation. So they just wash the patient and they don't change the gown, which is wrong. All right. Remove gown and place it into hamper. You're gonna, of course, make sure to check the water temperature. First, you check it if it's comfortable, then have your patient check it also if it's convenient for him. Don't forget to put on clean gloves. Don't forget your gloves before touching your patient. Now we should move to skill demonstration. Please pay close attention and practice as much as you can. Thank you so much for watching, subscribing, commenting. Should you have any question, please feel free, put them there. I will get in touch with you guys. I will answer you guys. Once again, thank you for watching, following Official Suad for nursing assistant skills and education, your true way to success. Let's go. Let's start. It is very important to reduce the scale interruption. So to do so, you have to remember to gather all the supply you need for your scale. Going back and forth out of your client room might put your client's safety at risk. And during your practice or during your scale testing, you may run out of time. For this specific skill, you need at least 3 face clothes, at least 2 towels to dry, cover sheets, definitely a gown, new gown, a basin, a soap, and of course, a gloves. Grab your basin, fill it with water halfway, check the water, not too hot, not too cold. Make sure to have everything ready before going to your client room. As I said, I'm in my client home. It is a different setting than a nursing home or a hospital setting. You need, of course, a soap. Gloves, as I said. Gather everything. And now, introduce yourself. Explain procedures, speaking clearly, slowly, and directly, maintaining face-to-face contact whenever possible. Provide privacy with curtain, screen, or door. Before washing, check water temperature for safety and comfort, and ask client to verify comfort of water. Before removing gown, cover your client body with a cover sheet. Remove gown and place directly in soiled linen container while always ensuring client chest and lower body is covered. Gently move the client body part. Put on clean gloves. Beginning with eyes. Wash eyes with wet washcloth, no soap. Using a different area of washcloth for each stroke. Washing inner aspect to outer aspect, then proceed to wash face. Then pat dry the face. Now expose one arm and place a towel underneath the arm. Apply soap to wet wash clothes. Wash fingers, including fingernails. Hand, arm, and underarm, keeping the rest of the body covered. With a new towel, rinse fingers, arm, hand, and underarm. Get a dry towel and dry fingers, arm, hand, and underarm. Put clean gown on client. Move body gently and naturally.
avoiding force and overextension of limbs and joint. After dressing up your client, remove the towel underneath the arm gently. Position your client as he or she desired. Bed luck and at the lower position, signaling device within the reach. Dispose of linen into soiled linen container. Empty, wash, dry the patient and put it in designated dirty area. Remove the gloves. Wash your hand with soap and water or sanitize them. Skill is complete.